Hello GOTA members, looking to prepare for an exam or simply test your clinical knowledge? This video is for you. Welcome to the Bones Quiz. Which of the following are proximal carpal bones of the hand? Hamate, Pisiform, Triquetral, Lunate, Scaphoid. Pisiform, Triquetral, Lunate, and Scaphoid are the proximal carpal bones of the hand. A useful mnemonic to remember the carpal bones is some lovers try positions that they can't handle. Scaphoid, Lunate, Triquetrum, Pisiform, trapezium, trapezoid, Capitate, Hamate. Which of the following is a fracture of the distal radius with dorsal displacement? Smith's fracture, Colles fracture, John's fracture, Barton's fracture. Colles fracture is a fracture of the distal radius with dorsal displacement. Which carpal bone, when commonly fractured, is at high risk for becoming necrotic due to poor blood supply? Pisiform, Lunate, Scaphoid, or Capitate? The scaphoid is at high risk for becoming necrotic due to poor blood supply. The scaphoid bone is located between the hand and forearm of the thumb side of the wrist. It is the largest bone of the wrist and is shaped like a medium cashew. What type of finger fracture results in a mallet finger? Proximal phalanx fracture, middle phalanx fracture, or distal phalanx fracture? A distal phalanx fracture results in a mallet finger. A mallet finger is where the end of the finger is bent or flexed toward the palm and can't straighten. A mallet injury occurs when an injury tears the tendon from the end of the finger. Instead of surgery, treatment involves keeping the distal joint straight for 6 weeks to help the tendon heal. The splint should be small enough to keep only the most distal joint straight. Your client falls and braces themselves with an open hand, extended elbow, and an extended pronated wrist. This results in an intra-articular fracture of the distal radius with dislocation of the radiocarpal joint. What type of fracture does the client have? In other words, what type of fracture is an intra-articular fracture of the distal radius with dislocation of the radiocarpal joint? Smith's fracture, Colles fracture, John's fracture, or Barton's fracture? Barton's fracture is an intra-articular fracture of the distal radius with dislocation of the radiocarpal joint. Barton's fracture is distinguished from Smith's or Colles fracture due to the intra-articular component. Treatment of Barton's fracture is usually done by open reduction and internal fixation with plates and screws. Name the two articulating surfaces of the shoulder joint. Head of the humerus and the glenoid cavity of the scapula, head of the humerus and the acromioclavicular joint, or head of the humerus and the clavicle. Head of the humerus and the glenoid cavity of the scapula are the two articulating surfaces of the shoulder joint. The ball and socket joint between the scapula and the humerus allows for incredible mobility but compromises joint stability. Stability of the shoulder joint is provided via the ligaments glenohumeral, coracohumeral, transverse humeral, and coracovicular. Acromioclavicular joint dislocation is common in collision sports such as football, rugby, and hockey. The most common mechanism of injury is abbreviated with the acronym FOOSH. What does FOOSH stand for? Friction on a forced shoulder hinge, force on an outstretched hand, or fall on an outstretched hand. FOOSH, F-O-O-S-H, stands for fall on an outstretched hand. Fall on an outstretched hand, FOOSH, injury severity depends on the force of impact, type of ground, way the person falls, and whether the person has any comorbidities. Some FOOSH injuries are non-surgical and take a few weeks to heal. Others require surgery and a prolonged recovery period. Both Colles and Smith fracture are common FOOSH injuries. True or false? The dorsal scapula is divided into two unequal parts, supraspinous fossa and the infraspinous fossa, created by the spine of the scapula. True, the dorsal scapula is divided into two unequal parts. What causes impingement syndrome of the shoulder? Failure of the scapula to elevate the acromion process, dislocation of the AC joint, and irritated bursa in the glenoid cavity. Impingement syndrome is caused by a failure of the scapula to elevate the acromion process. Common symptoms of shoulder impingement include difficulty reaching up behind the back, pain with overhead use, and weakness of the shoulder muscles. Prolonged impingement and tendon irritation can lead to rotator cuff tears. Impingement syndrome is diagnosed with a medical history, physical exam, and occasionally an X-ray to rule out arthritis. Thanks for tuning in! Comment below for additional quiz topics for the GOTA to cover.